Hello, I thank the conference team for the opportunity to present at this event, and I thank all of you for joining us for this presentation. iRLtd is an early preclinical stage biotech startup developing novel therapies for cancer, starting with a focus on gliomas. My name is Androutsellis-Theotokis, and I am the CEO and CSO of iRLtd. This slide is for reference in case you wish to delve deeper into the science after the presentation. At the heart of our work is a novel molecular mechanism that iRLtd scientists discovered and named the Hes3 signaling axis. It offers new therapeutic opportunities in both degenerative disease and multiple types of cancer. As I mentioned, let's skip it for now and follow me to dive into this story. Our therapeutic concept is simple. The pathway is generally turned off, but tissue damage induces its activation in specialized cells. Then the pathway contributes to regeneration. You can treat it as a magic box for now, where damage happens and the magic box drives regeneration. Many cancer cells, including bona fide cancer stem cells, exploit this pathway. After all, cancer is a type of aberrant regeneration. We have ample data to support our thesis. We will present data that fall into 4 categories. Tissue damage activates the pathway. Disrupting the pathway disrupts regeneration. Boosting the pathway boosts regeneration. Then we will focus on oncology. Disrupting the pathway kills cancer cells, including bona fide cancer stem cells. And pathway levels predict low patient survival. Tissue damage activates the pathway. Let's take a brief look at some select data from different models. Hes3 is at the core of the Hes3 signaling axis, hence the name. In the normal pancreatic islet of a Hes3 reporter mouse, you can see that Hes3 is expressed, albeit at low levels. If you injure the islet by administering the toxin streptozotocin, then Hes3 expression increases dramatically. We have similar results for other tissues, including the brain and adrenal. These results show that Hes3 induction is an innate response to damage in multiple tissues. Disrupting the pathway disrupts regeneration. We used Hes3 knockout mice for these experiments, and streptozotocin to damage the pancreatic islets. Following pancreatic damage, Hes3 knockout mice exhibit greater cell death, hence they turn diabetic faster. They also exhibit reduced regeneration of the islets 5 months later. In the brain, we use the Cooperson diet model that induces demyelination. Hes3 knockout mice exhibit perturbed regeneration. These results show that proper operation of the Hes3 signaling axis is important to withstand tissue damage and to regenerate. Boosting the pathway boosts regeneration. Here we administered soluble factors directly into the brain of rats that had been previously subjected to damage by either ischemia or 6-hydroxydopamine-induced Parkinsonism. Treatments that activate the Hes3 signaling axis protect injured neurons and improve motor skills in these preclinical models. We note that cells that express Hes3 and respond exceptionally well to pathway activation are endogenous neural stem cells and oligodendrocyte progenitors. These results show that pathway activation leads to disease modification in multiple models. Disrupting the pathway kills cancer cells. I hope the previous data showcase the significance of the Hes3 signaling axis in vivo. Now we will switch to cancer research, our current focus. Hes3 sRNA kills culture cancer cells, including bona fide cancer stem cells from multiple patients and multiple cell types. We are currently pursuing this work in vivo, having already demonstrated the presence of our target cells in mouse xenotransplantation models. The pathway predicts patient survival. This work is from non-affiliated peers who have followed up on our work. 2 labs show that patients with lung cancer or rhabdomyosarcoma who exhibit high HES3 expression in their biopsies have a significantly reduced survival. Taken together, these data make a very strong case for introducing the HES3 signaling axis in medicine. Please contact us for detailed biochemical information. We are always happy to talk science and to direct you to our most relevant publications. We can also direct you to coverage of our work and to corroborating evidence from our peers in the scientific literature. Our assets include granted and pending intellectual property at the PCT internationalization phase on the use of HES3 sRNA in brain cancer and the repurposing of 36 FDA-approved drugs in oncology in any type of cancer in patients exhibiting high HES3 expression. We have a great team and formidable support. Innate Repair is a spin-off company of the Technische Universität Dresden, a center of excellence in Germany. It is registered in the UK. We also formed a subsidiary in Germany, Innate Repair Saxony GmbH. We are collaborating with top institutions, including the Technische Universität Dresden and the Medicines Discovery Catapult, which is the UK government-supported research technology organization, and multiple other universities, including the University of Cambridge, the University of Chicago, and the Hebrew University. We have secured seed funding that is sufficient to complete the preclinical validation of the HES3 sRNA. We are looking for partners to bring this technology to the patient. Thank you very much.